All right, joining me on the hotline as we do each and every week is, of course, Dr. Dan Zanotti from the Center for Orthopedics with an injury update. Dr. Dan, how we doing, man?
Doing well, Dustin. How are you?
Okay. You know, I'm battling through the tennis elbow that I've been battling for, I don't know, like the last year, it seems like, and it's getting a little bit worse now. And I've got all these people, Dr. Dan, in my life that come to me and they go, you got to get a cortisone shot. You've got to get this shot. It'll help. I'm scared to death, Doc. What do I do?
There's lots of treatments for tennis elbow. It's very common. It's very annoying. As you know, you get it from racket sports, but you can also get it from golf and even gardening and other things. And it's that inflammation in the tendon of the muscles that attach up to the end of the arm bone. So there are certainly things like therapy. There's braces. There's medicines that you can take, topical and by mouth. And then there's also injections. And it's a little bit controversial. There is some information about cortisone causing some bad effects to the muscle because you are injecting it into the muscle and tendon. It's not like an injection you do for arthritis into a joint, into a space. For these particular type of injections, yes, it can help, but we worry about it causing muscle degradation and muscle weakness permanently down the road.
So what scares me about injections, and this has been my entire playing career, is that if I numb a muscle or a soft tissue, if I can't feel it, I feel like I can do more damage. Is that true?
Yeah, in some ways it's true that you need that proprioception back and that sensation of pain to avoid doing more damage. There is some medical benefit to cortisone in the sense that it does diminish inflammation and it helps get rid of some of the inflammatory response. But you're right, then it sometimes encourages people to do more and more than they're capable of doing. There's been a lot of interest lately in doing different types of injections, things like platelets and stem cells, which are a little bit controversial. But there have been some data that it can help that, and it actually regenerates tissue as opposed to just hiding the inflammation that cortisone does. So it's something that we're certainly looking into and like to participate in, and I think it does have some long-term improvement.
Oh, that's great insight, as always. And now that you've called me out, I'm going to have to call you at 440-329-2800 at the Center for Orthopedics. Dr. Dan, you're the best, man.